Terrorist, or am I a criminal?
Bismillahirrahmanirrahim. Assalamu alaikum and welcome to the program. It is a Thursday morning, and that means you and I are together on the mid-morning show with me, Julie Alli. Love being here and lots of interesting things to uncover on the show this morning. We'll be talking with Professor Yaseen Ally, who is an associate professor in psychology at Nelson Mandela University. He is a relative. He's actually my nephew, and I'm very proud to say that. Wonderful person, and we're going to be talking about amazing things as far as mental health is concerned. Later on, we're going to look at the impact that lockdown has had on drug addicts, and where to from here as far as the global community is concerned, and the pandemic that we're not talking about is substance abuse. Then we'll be talking with Raisa Bulbulia about inclusivity, accessibility, and resources for children with differences and disabilities. Sad to say that people with disabilities are almost the invisible society within our communities. The significance of Rabiul Awal is what we'll be looking at as well with Maulana Muhammad Tariq from Phoenix. And we're going to be wrapping up with that amazing competition. And that, of course, is the Salam Media Quantu Private Game Reserve competition with a fabulous prize up for grabs. First up, mental health with Professor Yaseen Ally. He is a research psychologist and a registered counselor with the Health Professionals Council of South Africa. He teaches both at the undergraduate and postgraduate levels. He specializes in cultural belief systems and mental health as well as GBV issues. Yaseen Ali, Assalamu alaikum, welcome to the program, and what a pleasure to have you here with me today.
Walaikum salam. Thank you, Julie Ali. I'm going to call you Auntie Julie, though, given the fact that you are my aunt and I am your nephew. Absolutely. So I'm just going to stick to tradition and call you Auntie Julie. That's okay with me.
I'm happy with that. Yaseen, are you doing well?
I'm well, thanks. No complaints. I mean, given the fact that this year has been so stressful on all of us, I'm just very grateful and happy to be where I'm at this moment in time.
Alhamdulillah. I don't even know where to start. I was talking to Shazia, my producer, and I was saying to her, there is so much to unpack. I mean, mental health is such a wide field. And I do know that you specialize in cultural belief systems. You and I spoke about this off air a little while ago. But before we delve into that, I am going to be talking to someone who runs a drug rehab center a little later on. And undoubtedly, mental health is so closely tied in with addictions because obviously, as a professor yourself of psychology, I'm sure you will agree with me. This is not based on scientific evidence, but you can agree or disagree that people who have addiction problems have mental issues. Is that the reason why they then seek solace in drugs or some sort of, I don't know, pain diffuser, painkiller, whatever you can call it?
Absolutely, Auntie Julie. I think it's very important for us to understand that when we do speak about substance abuse or the use of any addictive substances, that there is a root cause. There's something that's actually getting the individual to that point. Because the substance serves as a function to almost numb the feelings, numb the thoughts, and give you a sense of freedom from whatever emotional, physical, social, experience you may be going through. So that's important for us to keep in mind. And I'm so glad that you're going to be chatting about substance abuse a little later in the show and the links to mental health, because 2020 and the lockdown in South Africa was also met with not just the trauma of the COVID-19 virus, but we also had very specific rules put in place with regards to smoking and with regards to drinking. And we find that many South Africans went into a state of what I would term a forced rehabilitation space. And this forced rehab space was not actually a good thing.
No, and sadly, we do know that also led to a whole host. I mean, we kind of have always put the GBV issues behind closed doors, so to speak. But I think the lockdown forced us to re-look at the situation very closely.
I think that's important to also note that because we were all at home, the lockdown forced us in various ways to look and to re-look critically at the way that the world is actually functioning. And you would find that through this process, issues of race, gender-based violence, as well as mental health and substance abuse have started emerging and coming to the fore. So I think it's very important for us to keep that momentum going, especially in light of the fact that it is Mental Health Month, Mental Health Awareness. The 10th of October was International, Mental Health Awareness Day. And I think it's important, Auntie Julie, maybe I should start off very briefly about what is mental health for those who are listening. And a
All
very
right,
brief
just
definition.
before you go there, Yassin,
Yes.
let me ask you this one thing. We have established that there's a link between mental health issues or a person who is a substance abuser, that undoubtedly it goes with, possibly without saying in 99.9% of the cases that there's an underlying mental condition there. Why is it
Yes.
that there is so much of denial when you broach the issue with the addict, with your loved one? They will not admit to the fact that there's a mental health issue related to their substance abuse.
That is something that can happen very often, Auntie Julie. Remember when we're dealing with a person who is addicted to substances, it's almost the addictive behavior that becomes the personality. And that personality becomes the mask that the individual wears. And that mask is protecting the current drug behavior. Okay, because it works. It's working for that person. Maybe I'll have a drink, maybe I'll smoke, I'll use a certain medication to numb the feelings, to go to sleep during the day, whatever it may be. But obviously, that addictive behavior does not want to change. It wants to remain there. It wants to remain continuous because the body and the mind now develops tolerance towards that substance, that you cannot function effectively without having a certain dose of that particular substance in your system. As a direct result of that, you find that the persona a substance user actually puts on, an addict will put on, is an addictive persona. And that persona is going to protect the behaviors that will keep the addict where it is. So part of that comes with the denial that I'm not actually going through this drug problem. I'm actually in control of things. No, I'm not depressed. There's nothing actually going on. The denial for me, and most psychologists would agree with this, working with substance abuse is the biggest issue or challenge to break with your client. If you can get past the denial, you can start doing the work that is required.
Okay. We've agreed that when we talk mental health, it's a very, very wide open field. I think the more popular, for want of a better word, or the better known mental health conditions would be, for example, your bipolars and depression. Those are the two that kind of almost springs out at us. And when you look at the older generations, then there's the dementias, Alzheimer's, etc. But let's leave all of that in the parking lot. I'm hoping that I can hook up with you at least once a month if you are willing to join us on Salam Media on a once a month program, or once in 6 weeks,
That
or
would be
however.
lovely.
All right, so let's look at this very broad definition when we talk mental health issues. What does the ordinary layperson like myself need to understand when we say mental health issues or mental health problems, or this is Mental Health Awareness Month? What do I need to know? What do I need to be cognizant of? And how do I react, or how do I interact with people with different mental health issues?
Absolutely. I think this is it's a good vantage point and a starting point for us to begin with, because there's so many stigmas, stereotypes, and mysteries that people have created around what a mental disorder is, what mental health is. But for the listeners and for you, to break it down quite simply, we all get the flu, we all have tummy pains, we get headaches, we get sick physically, and as a result, we go to the doctor or take a medication that's appropriate because we feel the pain, we don't like the pain, so we address it. And we need to start embracing that the mind, that the brain is a part of this body. And when you wake up in the morning and if you are feeling something, you can't always put a finger on it. It's always good to ask yourself, but why? What is going on? Let me go to the root of it. Try to identify those feelings and also start embracing the idea that it is okay as a human to feel sad, to feel anger, to feel anxiety, to feel pressure. It's human emotion, and we need to start normalizing those.
Okay. As I've indicated, the better known mental health conditions would be your bipolar and depression, which is a very, very big problem. Would it be safe to say that a large amount of the population suffer from undiagnosed depression? You could be walking around leading a relatively normal life and not even know that you're suffering from depression.
Absolutely. That's also something to keep in mind, is that when we think of mental issues, psychological disorders, a mental condition, we have this image of a person sitting in a corner or laying in bed, unable to function, unable to speak. Yes, in many severe or in serious and severe instances and cases, a person may become immobilized. But for the most part, and for example, I like to use personal experience. I've been diagnosed with an anxiety disorder many years ago. And I found ways to actually cope with it, because what helped me cope most importantly, Auntie Julie, was speaking about it, talking to my friends, normalizing it, that I've got an anxiety issue. I sometimes panic at times, and I can feel that energy through my body. But I've learned that it's okay to speak about it, to acknowledge it, and then to work yourself through it. So for many individuals, and I know I want to go to, you're saying that, depression is one of the biggest mental disorders at the moment. In South Africa, according to the South African and the SADC, South African Depression and Anxiety Group, it is estimated that at least 1 in 6 South Africans experience a mental health problem, which implies that in our population of close to about 50 million, we're sitting with a large percentage of individuals who may not even understand that they are sitting with a diagnosable condition. And what happens is you tend to normalize those experiences and those feelings as being who you are, when in fact it's not who you are. It's just that your mind has produced a specific reaction to certain experiences and phenomena, and it's now reacting in that way to almost protect you. But you can overcome that. There's ways in which you can find solution through that.
Inshallah, in future programs, we're going to possibly unpack each condition individually and go into detail, really delve deep into the subject matter to understand signs, symptoms, how people, react, how to normalize a situation in a home, etc. But having said that, Yassin, when we look globally, we know that mental health is a huge issue. There's a lot of stigma attached to it. Is that the reason why we're having so much of angry people around us? I mean, we're stressed, anxious, angry people.
Yes, that is spot on. That is spot on. The fact that we are not acknowledging that we have these emotions that, for the most part, society and the world has labeled as bad emotions. These emotions that are like, your sadness, you're feeling down, I'm anxious. People have labeled them and categorized them as your bad feelings. So you are forced to almost, believe and internalize that I have to be happy. If I'm feeling a certain way, push it aside. But all of those feelings, they don't go away. They almost find a way to almost turn themselves into anger or ways to express themselves. Because if you think about a cup that's filling with water all the time, it's going to overflow at a certain point. And that's how our emotions are. You can experience sadness today or deny your feelings for 1 or 2 days, but after a while, it's going to boil up. And you can only take so much. And we find that in instances like that, a person is likely to become very angry, very anxious all the time. It explains it 100% for men especially, who are told from the time they are born that, expressing your emotions is not manly. That could be one of the underlying reasons why men are so angry, and the GBV rates are also escalating globally.
Okay, we're going to take an ad break, and when we come back, I want to delve a little into the issues around cultural belief systems. We have about, I'd say, 15 minutes left, less than 15 minutes. I'm not sure we're going to be able to do justice to that particular subject, but we can always carry it over. So don't go away. Let's go for an ad break.
Fantastic.
Okay, I think my producer has not heard me when I have suggested we're going for an ad break. So let's just continue talking.
Let's continue.
Yassin?
Let's do this. Yes.
Okay. Why did you decide to specialize in cultural belief systems? And I can, just before you respond to that, I know growing up as a girl, that whenever there was an unexplainable condition, if there wasn't a medical reason that you could attach to a person's condition, and if the person was just not getting better, and back in the day, I'm talking about when I was growing up, mental health wasn't widely known as it is now. Information is not at our fingertips as it is now. We immediately assigned it to Jadu. Immediately, when there was no explanation, if there was a personality change in a loved one, maybe due to alcoholism or drug or whatever the case may be, or he or she was depressed, we immediately, assigned it to a Jadu and then subjected the person to maybe beatings from Maulanas or whatever else went to exercise that jinnat or that bad or that evil entity within them. Your thought, your take, and what made you so interested in cultural belief systems?
It was exactly that. It was exactly what you've mentioned, because, even you growing up as a little girl during that time, many years ago, me growing up as a little boy in Indonesia, these were the sorts of beliefs that surround us, in various cultures, various religions. There is the belief in supernatural entities that have the capacity to influence human behavior and mental health. And what is fascinating is that if you look at the symptoms of spirit possession or jinn possession, for example, and if you look at the symptoms of schizophrenia or some of the other major psychological disorders, the symptoms are almost the same. It is the belief system and the construction that is created around what it actually means that becomes unique. So yes, that was what got me interested in understanding these experiences. And I started looking at South African Muslim faith healers, our Maulanas, and how do they work with patients who are then presenting with depression, with symptoms of depression or anxiety. Because obviously, from a psychological standpoint, depression is depression and requires treatment psychologically. And if it is misdiagnosed and not treated effectively, as we know, there are various charlatans that exist. They can take advantage of you. And I'm not denying that the supernatural does not exist, that jinn possession does not exist, that jadoo does not exist. But not every case of what you're experiencing is got to be linked to the supernatural. Sometimes it is exactly what it is.
All right.
I'm depressed,
Okay, I'm glad you said that you're not, you're not dismissing the existence, because alhamdulillah, we know Allah subhanahu wa ta'ala tells us in the Holy Quran, in the Quls, that there is, evil whisperers and people tying knots.
Absolutely.
We know that our Nabi also had an experience with the Jewish woman who tried to do witchcraft on him. How do you, as a medical professional yourself, as a professor of psychology, how easy is it for you to distinguish or pick up, over time, that I come to you and I say to you, I probably am suffering from schizophrenia, but I refuse to admit to it because of the shame, because of the stigma. Yes. I don't want to be labeled as a mental case. I'd rather go under the guise of it's jadoo, because by so doing, I'm going to get the sympathy and the support of my loved ones, my family and my friends, and let somebody else be the rogue. I'm not responsible. Somebody else is responsible for my mental health issue.
And it's not another human being, right? It's another being. It's this creature or a spiritual entity outside of myself that's coming and affecting me. I'm innocent, please help me. And that is exactly what happens, not just in Islam, but many of the cultures and religions that I have been studying in the communities that I've been working in. We find that people swing back to religious and cultural belief systems to explain everything that happens in life. Rightfully so, these
It's
are
more
the systems that guide us.
It's more comfortable and more acceptable.
It's more acceptable. Absolutely. And also psychology is something as a science that has come to us not too long ago. You know, it's a very young profession. And in South Africa, not many people are even aware of the word psychology. In many cultures, many religions, many languages, the word psychology and depression do not exist. So if the word does not exist in a language, how do people actually then treat it as, for example, depression? They're going to rely on the words and terminologies and the understandings they have for those sets of symptoms. And I think that's one of the biggest challenges that I faced, and I know many of my colleagues do face, is the sort of cultural competence we need to present when working with our clients, to almost distinguish at which point do we say to our clients that maybe seek out some, faith healing while you're getting some psychological assistance, or, there's got to be some sort of a give and take. It is very complicated, but working with the client.
At what point would you suggest that? What would be the red flag for you? At what point would you suggest that?
You mean like a collaborative work between faith healing and psychology?
Or possibly also that you've done everything you can for this particular patient, and you now perhaps suspect, what is it that would make you suspect that perhaps there's intervention needed here, intervention by a faith healer needed in this particular scenario?
Okay, so the most important thing to keep in mind is that when someone walks into your counseling room, into that office, there's a need to build trust. They need to trust the fact that you are able to assist them. And if a person walks into your counseling room firmly believing that what they're experiencing has roots culturally or religiously, it's going to be quite a challenge to almost extract that belief or that thinking from them. So in my opinion, I've always worked on a dual basis. I would tell my client, go for the healing, but come back next week and let us discuss what happened. How do you feel? Are you finding any relief from what's going on? And you would find that that combination often works, because a psychologist is not going to provide you with spiritual healing. They are there to assist you with the scientific healing of the mind through certain steps and processes. And part of that is acknowledging and embracing the client's lived realities. So taking their belief systems into account and bringing it into the system of counseling.
Okay. Oftentimes people who suffer from depression or any mental illness for that matter, and I'm sure you've heard this over and over and over again, is that they tell things like, goodness me, please get over yourself. You're a strong being. You can do this. You can rise above all of this and reclaim your life, so to speak.
Yes. This is, I think, one of the most damaging things that a person can actually say, because from a layperson's perspective, the normal person on the street, you would think, I'm helping my friend. Come on, you're feeling sad. Get over it. Let's just go out. Let's have a coffee. Let's watch some TV. Let's just talk. You'll be fine. You are strong. But in that moment in time, as much as the person may have the capacity to get through what they're going through, in that moment in time, they just need to be heard. That's all. They just need to be heard. So advice to everyone listening, if you have a friend or family member or loved one who is sharing something emotional, before you give advice or before you go to a solution, stay with them in that moment. Just listen. That's it. The power of listening. It will get the person to express and share exactly what they're feeling. And that in itself can form a relief. It's cathartic. It helps a person to almost process the thoughts.
Okay. Would you mirror what they're saying or just not say anything? Just listen.
Listening is important. You can mirror. So nod your head, shake, say, I'm listening to what you're saying. And if you don't have the answers, you can say, this is a really challenging situation. This is really tough. This is tough. This is hard. I don't know what to say to you, but I'm listening. Okay. That's important, because if a person, okay.
We've almost come to the end of the interview. Yassin, just I know we've touched on a lot of little things. Inshallah, in future programs, we'll hone in and unpack, different mental health conditions. But because it was Mental Health Awareness Month, let's look at what is the advice you want to leave our listeners with this morning as regards stigmatization, and if you are a person suffering from mental health, the type of support you want from people around you.
Okay, so if you are someone who's going through a particular mental health issue and you need support from someone around you, the first step that you need to keep in mind is, who can I trust? Because it's okay to talk. I'm suggesting that you need to talk and reach out, but talk to someone that you can trust first and foremost as a form of confiding. It's always important for you to know that you are not alone. In that moment, you may feel that you are completely isolated, but reach out to a friend, family member. And if this becomes too much for you, there are various national helplines like the South African Depression and Anxiety Group, who are very, very fluent in assisting us. There are various helplines and lifelines that have been developed. Also make an appointment with a psychologist if you can, but reach out. There are various platforms through COVID-19 as well, with the lockdown. Various helplines and organizations now have these WhatsApp chat groups where you can actually have a conversation with a counselor via WhatsApp or via email, which helps if you are the type of person who does not want to actually speak in that moment.
Yassin, absolute pleasure talking to you. I really and truly look forward to hooking up with you again, inshallah, in about 4 weeks' time, and hopefully start unpacking mental health and issues and how we can help our viewers and our listeners. Thank you indeed. And I do hope you're enjoying your part of the world. I know you're at Nelson Mandela University. Are you people open for business now? I mean, is everyone back at class, or is it still a lot of online learning going on?
There's still a lot of online learning going on, and we're slowly transitioning back to a new normal. It's going to take us some time, but just in conclusion, I know with time, Auntie Julie, I want to thank you for bringing me onto your show. I've had a lot of fun. I think we've had a nice connection just chatting, and I look forward to engaging with you and the listeners in the weeks to come.
Absolutely. I can't wait for our next session. It will be in about a month's time, and I really and truly look forward to. Take care of yourself in the meantime, and Salaam Alaikum to you.
Wa alaikum salam. Thank you very much.
That was Professor Yaseen Ally, an associate professor in psychology at Nelson Mandela University. He is a research psychologist and registered counselor with the Health Professionals Council of South Africa. He teaches both at the undergrad and postgrad levels. And of course, we're going to hear lots more from him in future programs. I've got him to commit on air that he'll come on to the show on a regular basis. Right now, it's time for an ad break. And when we get back, we'll be talking with Nazim Abrahams about the issues on drug addiction and the rehab center that he runs in Horizon, west of Johannesburg.